Summit Pharmacy not only makes the best compound out there on the market, but our team approach and the team behind the compound it certainly is invaluable to physicians and providers as they prescribe these medications. We have well-studied and well-educated compounding pharmacists that are available to you throughout the business day. Secondly, we have a pharmacist who can actually visit your office and help you as you try to choose a prescription that would be best for your patient, so that we have a pharmacist who can help guide you along there. As a practicing physician with some experience in this arena, I'm certainly always available to you for consultation or discussion of different compounds or topics that you would find interesting and of need when you prescribe your medications. So Summit Pharmacy not only makes the highest quality compound for your patient, but we back it up with excellent support, whether it be from pharmacists or physicians, to help you as you make your choices in the compounding arena. How is that? How about one more thing? Okay, just one more thing. So why would you use a compounding medication for certain patients versus other medications? The first thing I would say, if you're treating patients who have multiple medical conditions, there's great value in using a topical medication. While it won't be the only medication that you will choose in your arsenal for treating pain, it's an excellent medication, especially in this patient population. As I might have talked to you about before, certainly patients with diabetes are certainly at high risk for renal disease, and many of the medications we treat patients with for pain would be processed through the kidney. We know that topical compounds, while they do get absorbed, do not get absorbed at a high enough concentration to cause some of this renal insufficiency or frank renal disease. We also know that anti-inflammatories are especially difficult on the GI tract. I can tell you that certainly compounded anti-inflammatories are not going to cause these same problems and conditions. Finally, patients who you are treating for multiple medical conditions are already on several medications. We know that diabetics average 2.5 pills just to treat their diabetes, let alone their ACE inhibitor to help with their renal function, and many of these people then are on cholesterol-lowering medications. So suddenly these patients are already taking 4 or 5 pills, maybe 6 or 7 pills a day for their diabetic condition, and you want to add something else for their pain control. If we can add something where you can get multiple medications to the patient without affecting these other end organs, whether it be the kidneys, the GI tract, the heart, then you're doing them an excellent service while treating their pain, but still avoiding any of the other consequences that we sometimes will see from medications. How's that? There you go. So, let me think. Okay, so why compounding with an injured worker? As we know, many of these people have horrendous injuries, and certainly to treat their pain, these patients are often placed on opiates and placed on those appropriately so to control their pain. As this condition improves and the patient moves along the pathway of recovery, we feel that compounding is potentially an excellent treatment option, so an excellent treatment option for you with your patient. So perhaps this would be an easy way to ease your patient off the opiate therapy that you've been using to control their pain and get them on a compound that has multiple different ingredients in it. Once again, compliance is an issue with many of these patients, so you can get a patient on multiple medications with a topical compound and slowly get them off the opiates that they're taking. This does several things. First of all, the patient doesn't become tolerant to opiates, nor do we have to think about managing addiction after 3, 4, or 5 months on an opiate therapy. Secondly, we can get them and return them to work more safely because the side effect profile of a multiple medication compound versus the multiple medications is so much lower that we would feel much safer for our truck drivers or our steel workers or our carpenters returning to work with a compound than we would somebody who's on an opiate, perhaps some Neurontin, and maybe an anti-inflammatory, and then a muscle relaxer, all of which can cause fatigue, drowsiness, make it difficult to operate machinery, and to function really well around the work site. I know as a practicing physician, I would feel much more comfortable sending my patient back to work with something to help control their pain that doesn't cause the side effect profile that we spoke about, so that they can function better at work and become productive again. The end.
Yeah, I like that.
Okay?
Okay.
That's enough? That's my fireside chat.